My name is Kim Loon. I am a fourth year bioengineering student at the University of Toledo, and I was put on the fracture fixtures team at WishBone.
I'm Julia Hatfield. I was a product development co-op for the Nuts team.
My name is Chali Salkopratnipanya, and I am a product development co-op here at WishBone Medical. I go to school at Purdue University and I study biomedical engineering. And the team I work on here is the screws team, and we work on components for one of the most complex systems.
I decided to co-op at WishBone because I felt very strongly about the company's mission statement. I feel like since pediatric orthopedics is a very small field, it is wonderful that we're working towards improving the lives of children.
Working for pediatrics, it just has a lot more of an impact than, say, working for adults, just because the things that you do now affect them their entire life. So I think that's very impactful.
I chose to co-op at WishBone because I had heard from past co-ops that go to Purdue that co-oping here is such a great experience and you really get a lot of skills and knowledge that will benefit you once you graduate. So hearing all the great memories and stories from them about this company, I knew it would be a great place for me to start.
Would you say that you learned a lot during your time?
Yes, I learned a lot here. I was able to work on design matrices, risk worksheet, and SDA. I was able to attend cadaver labs and surgeon meetings. It felt very fulfilling learning all of these things that would help me pursue my career after graduation.
WishBone has helped me a lot, just knowing even what engineering and biomedical engineering is. I feel like working and learning from college is a lot different experience than working in the actual field, and I feel like I've learned a lot just to what we would actually be doing in my career. And I think it's helped me a lot just through knowing things like that.
I have definitely learned a lot during my time here. It has completely exceeded my expectations. Some of the things that I've learned during my time here are about the orthopedic industry. I had never had industry experience before co-oping here, so it's really a great first experience, and I learned about all the different regulatory and quality processes that go into making a medical device.
I'm excited to be able to improve children's lives. In a previous meeting, the CEO, Nick Dieter, talked about this child who had cerebral palsy and was stuck in a wheelchair, and all he wanted to do was be able to stand up at the sink and brush his teeth. And I think as engineers, we are able to do that and make that happen and improve their lives.
One major takeaway, I would say, I don't know if I could just say one, everything that I've learned here has just been really applicable. I think that I can use everything that I've learned here at other places, and just everyone who works at the company is just so good at being a mentor and teaching and really just showing you the ropes and how to do everything here. So I think all of it has just been a really great experience.
The major takeaway I have from coming here is that I could definitely see myself working in the orthopedic industry once I graduate. Since this was my first industry experience, I wasn't really sure before this what I wanted to do with my degree, and now after working here, I know that I would definitely be more than happy to get a job in the orthopedic industry and do that work.